Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Personality disorders. Introduction. Personality disorders are long-term patterns of thoughts and behaviors that cause serious problems with relationships and work. There are several different types of personality disorders. Each one affects people differently. However, people with personality disorders generally have difficulty dealing with everyday stresses and problems. This program will help you understand personality disorders. It reviews some of the most common personality disorders and discusses their symptoms, causes, and treatment options. Personality disorders. Personality includes a person's thoughts, emotions, and behaviors. It affects the way a person views, understands, and relates to the world. Personality also has to do with how a person sees him or herself. Personality develops during childhood. It is shaped by two things: inherited tendencies and environment. Inherited tendencies are the personality traits people receive from their parents. Children of outgoing social parents are more likely to be talkative. Children of reserved, timid parents are more likely to be shy. Environment refers to a person's life situations. It includes the surroundings a person grew up in and events that took place. It also includes the type of relationships a person has with his or her family members and others. Personality disorders are long-term patterns of thoughts and behaviors that cause serious problems with relationships and work. A personality disorder is a type of mental illness. Healthcare professionals use the term personality disorders to refer to personality traits that are disabling. People with personality disorders have difficulty dealing with everyday stresses and problems. These people often have trouble making and keeping positive relationships with others. Personality disorders typically begin during childhood. However, personality disorders usually are not diagnosed until adulthood. That's because adolescent patterns of thinking and behaving may be temporary. Symptoms. Specific types of personality disorders are grouped into clusters. These clusters are based on similar characteristics and symptoms. The three clusters of personality disorders are Cluster A, Cluster B, and Cluster C. Click on the links in the following sections to learn about the symptoms of each type of personality disorder. Cluster A personality disorders are disorders that include strange, unconventional thinking or behavior. Paranoid personality disorder, schizoid personality disorder, schizotypal personality disorder. Cluster B personality disorders are disorders that include dramatic or overly emotional thinking or behavior. Antisocial personality disorder, borderline personality disorder, histrionic personality disorder, narcissistic personality disorder. Cluster C personality disorders are disorders that include anxious, fearful thinking or behavior. Avoidant personality disorder, dependent personality disorder, obsessive-compulsive personality disorder. If you or a loved one experiences the symptoms of a personality disorder, talk to your healthcare provider. When left untreated, personality disorders may get worse. These disorders can cause significant problems in your life. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. The exact cause of personality disorders is unknown. Personality disorder may be caused by a combination of family personality traits and environmental influences. The personality traits of a parent or other family member can be passed on to children within that family. Racism and sexism are examples of personality traits that children may be exposed to at home. Over time, children may demonstrate similar personality traits. Environmental influences are the conditions that were present during a child's upbringing. Child abuse and recreational drug use by a parent are examples of environmental influences. While the cause of personality disorders is not known, there are certain factors that seem to increase the likelihood of developing a personality disorder. The following factors may increase the risk of developing personality disorders: abuse or neglect during childhood, diagnosis of childhood conduct disorder, family history of mental illness, loss of parents through death or divorce during childhood, poverty, unstable or chaotic household during childhood. Diagnosis. No medical tests can diagnose a personality disorder. The diagnosis should be made by a psychiatrist. A psychiatrist is a medical doctor who specializes in mental, emotional, and behavioral disorders. A thorough social and medical history is necessary to diagnose a personality disorder. The psychiatrist may ask about symptoms and family history. Family members or friends may also be interviewed about any changes in your behavior. A physical exam is generally included as part of the diagnosis. Blood tests and possible brain imaging may also be done. These tests can help determine whether the symptoms are caused by other medical problems. Treatment. Personality disorders tend to last much of the adult life. However, long-term treatment can help control symptoms. With treatment, many people improve enough to lead satisfying lives. Treatment for personality disorders usually includes one or more of the following: psychotherapy, medications, hospitalization. Psychotherapy is sometimes called talk therapy. It is the main way to treat personality disorders. During psychotherapy, you learn about your condition and how it affects your thoughts, behaviors, mood, and feelings. This helps you learn healthy ways to manage your symptoms. There are many different types of psychotherapy. Your healthcare provider can help you decide which type is right for you. Psychiatric medications that can be used to treat personality disorder symptoms include antidepressant medications, mood-stabilizing medications, anti-anxiety medications, antipsychotic medications. All medications carry the risk of side effects. Talk to your healthcare provider about medications that may be useful in treating your symptoms. You should never start or stop a medication without first talking to your healthcare provider. Many people experience greater relief from their symptoms by combining medications and psychotherapy. You can reduce your risk of relapse by following the treatment plan for as long as your healthcare provider recommends. Severe cases of personality disorder may require psychiatric hospitalization. This treatment is usually recommended if your personality disorder puts you or others in immediate danger. If you are in immediate danger of harming yourself or someone else, seek help. Residential treatment is sometimes recommended for people who need a supportive place to live while they receive treatment for a personality disorder.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Personality disorders are long-term patterns of thoughts and behaviors that cause serious problems with relationships and work. People with personality disorders have difficulty dealing with everyday stresses and problems. Personality disorders typically begin during childhood. However, personality disorders are not usually diagnosed until adulthood. The exact cause of personality disorders is not known. There are certain factors that seem to increase the likelihood of developing a personality disorder. Many of these factors relate to social, emotional, and economic conditions that were present during childhood. No medical test can diagnose a personality disorder. The diagnosis should be made by a psychiatrist. A psychiatrist is a medical doctor who specializes in mental, emotional, and behavioral disorders. Treatment for personality disorders usually includes psychotherapy, medications, or a combination of both. Hospitalization may be needed if the personality disorder threatens the safety of self or others. Personality disorders tend to last much of the adult life. However, long-term treatment can help control symptoms. With treatment, many people improve enough to lead satisfying lives.
Thank you for using Explain.